Yeah, thank you, Dr. Wika. Good late afternoon for Prof. Paul, maybe for Prof. Amir. I don't know now, it's evening or maybe late afternoon too. Yeah, and Pak Teguh. It's just to be my student. Yeah. Yeah, but yeah, congratulate you are become an associate professor now. Yeah, so first of all, yeah, thank you and congratulate for the 20th anniversary of Center for Bioethics and Medical Humanities, Faculty of Medicine, Public Health and Nursing. And thank you for Prof. Yati, Prof. Rika, Prof. Narto, who are inviting me to be discussant, as well as Dr. Wika, Bu Erlin, and then Dr. Asid.
Hello, Prof.
Yeah. So I'm looks handsome in that camera, yeah, but I'm a woman. Yeah. It's late afternoon. Yeah. So I have to comment on this session, bioethics responding to COVID-19 pandemic, ethical issues and coping in pandemic views from across the continent. Next, please. Who can? I can. Who to where? Yeah. Oh, yang tengah. Okay. Yeah. So the objective of this session, so the presenters will, or already, not will, already explain about how does the country region cope with the COVID-19 and then the ethical issues and challenges in responding to COVID-19 in their region, and how can bioethics contribute to solving the issues that occur due to the COVID-19 pandemic. No, no, yeah. So secondly, thank you for the excellent presentation for Prof. Amir Jafri from Center of Bioethics and Culture, Karachi, Pakistan, Prof. Paul Komisaros from Monash University, Australia, Prof. Pat Irvin, University of Washington, Seattle, United States, and Associate Professor Teguh Haryo Sasongko from Perdana University, School of Medicine, Malaysia. So I especially very impressive for your presentation. All is, yeah, explain comprehensively what happened in your countries, and then also what bioethics think that we should consider. Yeah, I think next please. I cannot do by myself. Yeah, I need Asrat. We call Asrat. Yeah. Yeah, the assistant for the video, assistant Sorot. Yeah. Yeah, Asrat. So what we learned from this session, yeah, the pandemic resulted in many issues, yeah, including ethics. So three of the presenters discuss about how to cope with the impact of healthcare, while the application of doctors in time of crisis, and Indonesia also already lose more than 100 doctors. They are die because of COVID. And then resource allocation decision, where this is a lot of ethic dilemma occur in that kind of events. And then impact of strict quarantine restriction. Yeah, it is also debated here, quarantine or isolation. Yeah. So, and then presenters also discuss about the need of research regarding the treatment, vaccine, and then understanding the disease itself. Because, yeah, we do not know yet completely with the disease, including the virus. Yeah, we still a lot of research. And then Prof. Teguh already discussed about how what the participant is military that they should do, or they are participate with willingness to participate or altruism. Yeah, and then presenters also discuss about the regulation. So in Indonesia, recently the government regulate for the wearing masks, and then a lot of people posting how the government implemented this regulation. So because if you violate the regulation, you will be fined or punished, even the doctor itself. And then I just saw the video that the doctor, because maybe from the hospital, and then he was not wearing, he did not wear the mask, and then he has to, what do you call nyapu, swap the, yeah, he has punished by the policeman. Yeah, yeah, cleaning the road. Yeah, sweeping the road. So it's so funny. Next, please. Yeah, and then the pandemic also resulted in other issues, economic crisis, racial justice movement. In Indonesia also a lot of happened stigmatization for the community or people who are suffering from the COVID, and they refused by the community as well as the health provider also when they want to go home. So some of the people refuse them, and then they should be in the special house, yeah. So it's a lot of things happen. And then climate change that also experienced by United States, fires, storms, yeah, natural disaster that coming together with the this disaster or this pandemic. And then rapid expansion of police power or also military, yeah, this also happened. And then curtailment of the individual liberties, yeah. We stay at home, but as Prof. Madarina said, maybe this is the blessing in disguise. So the family now is tight at home. Yeah, before the woman also go for work, but now mother is working from home. So this is also the positive things. And then the big data and electronic surveillance technique, this also raise the issues of confidentiality and also exposure deep social and cultural division. Next, please. Yeah. So the ethics that may be discussed, that already discussed by all the presenters, and thank you for that, with the excellent presentation, is autonomy, community, that's for the research subject, and then the autonomy of community to, like in Jogja, for example, they also lock down by themselves, not by the government, yeah. And then beneficence, this is the health protocol that should be implemented widely, but sometimes we have to persuade the community what is the benefit to follow the protocol, because we know a lot of our people, sometimes they not follow the protocol. And then justice. Well, some of the presenters discuss about the economy. I just, in my mind, I just think about the education, because now they have to study at home with the IT things, yeah, technology. But how about the poor? How about the people here in Indonesia that they cannot access of the information technology? So where the justice? They should learning, yeah, they should go to the school. But now, yeah, a lot of children cannot access, yeah, because of the Ministry of Education here have policy that in the zone that not red zone, they can open the school, but for red zone cannot open the school. Also the altruism, there's also blessing in disguise. Some of the solidarity, sorry, this is a typo. And then social sensitivity. And then I already mentioned about the big data. Next, please. I think this is the last. So Prof. Paul, thank you. You raised a lot of questions. Yeah, this I just take a few of them. What is the trust information? It is the end of globalization or the end of traveling. What will be the effect of pattern of sociality, especially the countries that being social is priority? And then sexuality, and then structure and process of dialogue, and will individual right and freedom ever be fully restored? Yeah, I think this is the last. Yeah, in summary, there are some ethical issues and problems that we should think, discuss, and collaborate and solve. And we need many studies to understand more about the disease, but we should apply the research ethic principles. And there are many questions that we still need to be resolved, and we still need to be collaborate, and we can use the IT like today to discuss together. Thank you very much.